Here's Ray Skywalker's image. We're just going to play with the brightness, latitude and detail contrast sliders here, and they will affect the curve applying to the histogram in the lower right hand portion of the screen. If I increase the brightness value, the image becomes whiter, more shades of white, brighter in display. Likewise, if I decrease brightness, it becomes darker overall beyond 0. And the position of the curve on the histogram has changed. I can reset that back to my last saved position. I can play with latitude. If I increase latitude, the curve has now become flatter. There's more shades of grey in the grayscale displayed, so each step is a smaller step. And if I decrease my latitude and go back beyond 0, it becomes a more contrasty image with less shades of grey available, and hence the curve on the histogram is now much steeper. Finally, in playing with edge or detail contrast, you're actually manipulating the finer edge enhancement in the image. 1 or 2 small clicks, almost imperceptible change. Lots of clicks becomes quite stark in the edge enhancement applying to the image, and you can go all the way to the bottom of the jar if you wish. Likewise, if you go back to 0 and you start decreasing detail contrast, you're actually taking edge enhancement out of the image processing algorithm and making it softer in appearance, which in effect is taking that detail sharpness away from the image. And if you go all the way to the bottom of that jar, then you are looking at an image that looks very much like the first digital image that Mr. Runken captured without the image processing algorithm. It's all very blurry, but you can see that it does look like some form of X-ray. Reset, and takes me back to my last saved position. If I want to reprocess this image as a different view, I can. I go across the Glasses tab and I need to change the view name. So within the view name here, I can process this image as a pediatric chest. Let's go with a pediatric chest and pick a ped supine, and the image will process with a finer kernel in image processing, so structures appear a bit sharper and the densities change quicker as the patient, a small pediatric patient, changes shape faster than an adult. I would tend to use, if we're using a portable, I would do those views on a portable study, but there aren't any pediatric views other than the ones in here for the pediatric study. Again, it's got a smaller kernel in image processing, so there's a lot less pixel averaging and fine structures appear a little bit sharper, and there's a more variance in the contrast of the image. Okay, so you can reprocess as anything you want. You're never locked out. I could process it as a hand, I could process it as a mobile hand or a mobile foot, lower extremity, ankle lateral. The data set now has been processed as a foot, with taking in mind that it thinks it's a foot anatomy in play. Okay, and if I want to change it again, I can. You can change it as many times as you want. Just got to pick where you want to go and what body part you wish to process the image as. Supine chest. Excellent. Thank you very much for your time.